I'm Sherilyn Skolnicki, and this is Brilliant Balance, the show for working women who are ready to shine. Each week, I bring you ideas, inspiration, and insight on balance, business, and getting it all done gracefully. You ready? Let's be brilliant. This is episode 199 of the Brilliant Balance podcast, and we are talking today about letting go of control with my guest, Dr. Nathan Fite. So I don't know about you, but I like control a whole bunch. It's something that I say often in my family. It's become a little bit of a refrain. I say it a lot in the Brilliant Balance coaching community. And I know I am not alone. I know that a lot of the women in this community really crave control over ourselves, our circumstances, our work, our families, the weather in my case. Sometimes I wish I could control the weather. And this battle with control, this desire to have control, can really get in our way. So my guest today, Dr. Nathan Fite, is an expert in this arena of really what our desire for control can do to us. Dr. Fite is the founder of the Cincinnati Anxiety Center. And he created this center in 2020 with the vision of providing youth and adults with really access to the highest standards of care in the treatment of anxiety and anxiety-related disorders. He is a husband and a father, and he has a PhD in psychology from the University of Cincinnati, where he also has a master's degree in applied behavior analysis. He talks during the interview a little bit about some of his background. But what I find the most intriguing are his ideas about what anxiety and anxiety-related disorders like OCD, which he says shares in this episode that he personally has struggled with, how much they are rooted in our desire for control and our discomfort with uncertainty. And what he shares in this episode, I think, is so practical and so pragmatic that whether you personally are struggling with a rise in anxiety, as so many people are in this post-COVID year, or one of your children is, or someone in your family, or you're seeing it in your workplace, I think there are really practical ideas that we all can use in our daily lives. And then he also shares some insight about when it might be time to engage professional help. And the answer is sooner than you might think. So you may be surprised by his answer to that question when we get to it in the interview. You'll find him to be really smart, but really engaging. And he has so many ideas here that I hope you will find value in. So without further ado, here's my guest, Dr. Nathan Fite. Welcome, Dr. Fite. Thank you so much for being with us today. I wonder if you would indulge us by just telling us, what did today look like for you? What's on your calendar? How are you structuring your day today?
It's been a great day so far. Actually, I woke up this morning to a hug and a kiss from my two daughters, Zoe and Mia, had a double shot of espresso, had a great supervision time with two of my clinicians, Skylar and Allie. And now I'm into, for the remainder of the day after this, seeing patients until I go home to my family again. So booked up, but excited to be here with you guys.
It's awesome. It sounds a lot like our lives, the bookending of like little family time, little self-care, into the workday, and then back to it again. Awesome. Well, I thought it might be interesting. I always love the perspective on how people got into their chosen profession. How did you decide to pursue psychology as a career?
Well, it's funny. I was always interested in the brain, even from a young age. My mom would tell you that when I was, 5, 6 years old, I was telling her that I wanted to be a neurosurgeon. So there's been this fascination with the human brain, with behavior that I've kind of had my entire life. But honestly, the profession found me. And I, after my first year of college, didn't really know what I wanted to do. So I decided to go out on an adventure and go into culinary school. So I went to a place in New York City called the French Culinary Institute. And then from there, I went to a school called Alma in Parma, Italy, where I was going through a culinary program. And that was really where I had my first bout of mental health issues that came my way. So it was really kind of like one night to the next, came down with really severe depression and anxiety. And honestly, ended up meeting my wife over there. But after that experience, I decided to kind of make a rather big change, go back to college and finish up my bachelor's degree in psychology. And then from there, I applied to a grad program at UC, got a full ride into a PhD psychology program at UC, and kind of went into the profession that way. Now, specific to OCD and anxiety, during my dissertation year, I had another really major bout of anxiety and depression, but this time it was a little bit different, more intense. And that's where I had my first diagnosis of OCD, decided that I wanted to pursue treating the condition. I had some difficulties accessing good care. And so I thought that, a fulfilling avenue for me professionally would be to help people access the right types of treatment as quickly as possible and alleviate some of that suffering for others.
Yeah. It's never going to stop being fascinating to me how many people's true callings, like purpose-driven callings, are rooted in some pain that they have gotten to the other side of and then turn around and teach from or help people through. That the notion of alleviating suffering is something I've heard from so many of our podcast guests who walked their own walk and now are just like turning and pulling people along the way. And you ultimately decided to open your own clinic. You run the Cincinnati Anxiety Center. So tell us a little bit about how you decided to do that. Like what led to opening your own practice?
Yeah, so there was a few things. I think the first one was I decided so in psychology, you have an APA internship. So it's an internship accredited by the APA. And then from there, I decided I wanted to do a postdoc. And I was throwing my name out in a few different places, but it happened to be the one that intrigued me the most was the Anxiety Treatment Center of Greater Chicago. And it was a really great opportunity because I was going to be able to be supervised by a woman by the name of Karen Cassidy, who was at the time the president of the Anxiety and Depression Association of America. And so this was her private practice. I had really great supervision from a really reputable clinician. And I fell in love with the treatment processes. We had patients coming in with all sorts of anxieties, obsessive compulsive spectrum disorders, and they were getting better. So coming into contact with evidence-based psychotherapeutic interventions that actually work and alleviate some of the suffering was, I guess, a crucial moment for me. Then from there, I went to Kansas City for a pediatric postdoc at the Kansas City Center for Anxiety Treatment, and then looked at other Midwestern markets, saw that there wasn't an anxiety specialty clinic in Cincinnati, my hometown, and just kind of decided over COVID to take a step out and take a risk and try to provide a service that I think was well needed in the community.
Yeah. And I want to talk a little bit about the rise in anxiety during COVID and post-COVID. But before we do that, we're going to talk a lot about anxiety today. So in your words, like what is anxiety? What's the working definition that our listeners should have?
So I think there's two different definitions to pay attention to. They're two important ones, but they're a little bit distinct. There is the definition that comes from our understanding of psychophysiology, which would be kind of like the more brain definition of it. So we know that there's certain neurocircuits associated with the fear response. One in particular is the amygdala. It's a certain region of the brain that we know is kind of the promoter of the fear response. And then we also have the endocrine response that the amygdala triggers through its action. And so you have the sympathetic activation of your nervous system. And so at a psychophysiological level, that's what's going on. But I think when we talk about anxiety, I guess in more colloquial terms,
Layperson's terms,
we're actually referring to, what it is it's that gut feeling that you have where your heart increases. You have that feeling that something is wrong in the environment. Your heart races, you might start sweating, you feel clammy, and you have that motivation of escape. Like, I need to get out of here, or I need to fix this problem, or something terrible is going to happen.
Yeah. And, as you say that, I think about one of the analogies that kind of has always worked for me is I don't like snakes. I would say I have a fear of snakes, right? And so as soon as you start talking about that, I start thinking about snakes, and all of those physiological responses make sense to me. I mean, if I am out running or walking and I see a snake in my path, or even like a piece of rope I think is a snake, I am across the street and 100 yards up that road before I know what happened. So that desire to sort of get away from whatever is triggering that response makes sense to me when we look at something like, I'm sure a lot of people are afraid of snakes. In people with anxiety who have a clinical diagnosis of anxiety, it sounds like that same response gets tripwired by something that may not actually be dangerous.
Yeah. So I think it's important to differentiate between two common terms here. One would be the term fear. And so when I define fear, I define it as being afraid of an actual threat, meaning that there's something in the environment that actually is dangerous for me and requires motivation to change or alter or get away from. Anxiety as psychopathology, what we're really referring to are a couple of things. One is either an overestimation of threat, meaning you're afraid of something, but your response is disproportionate to the actual risk. And that's happening pathologically. The second one would be you're actually afraid of something that's not dangerous, meaning this thing is causing an anxiety response, but it doesn't pose any threat to you. And so when that happens to the degree at which it's impairing your ability to function in some important way, that seems to be the line at which we call it a disorder.
And that feels important because virtually anyone listening today is going to be able to relate to, yeah, I felt anxious about that or nervous about that or uneasy about whatever the situation is. That what you just said, though, the point at which it's impairing your ability to function in your daily life, your world is essentially getting smaller. There's things you're not doing because of that anxiety response. That's where it becomes like probably time to raise the flag and get some help.
Yeah.
Yeah.
Yeah. And just know, I think it's really important for us to not demonize any particular emotion. In fact, when we're working with patients, we really emphasize that anxiety is a wonderful, wonderful motivational state that we've developed as a species, and it keeps us safe and it motivates us to take action in really important ways. And if you didn't have it, it would be troubling to you. But at the same time, it's a double-edged sword. And there's a point at which we kind of have to pull the reins back on it.
Yeah. Yeah. And you mentioned this earlier when you said you opened your practice during COVID. It feels like, I have my kind of ear to the ground with a certain cross section of women, often moms. It feels like we've seen a really big increase in anxiety as a symptom and anxiety related disorders in the year or so since COVID. Is that true, or is that like just perception and mythology?
This is one of those moments where your intuition's correct. So yes, anxiety is going up. In fact, I was just looking up before this conversation that the American Psychiatric Association put out a survey to adults. And what they found was that 62% of American adults are saying at this point that they have more anxiety than they had last year at the same time. Now, in that instance, we know that there's some events that have precipitated that. But even before that, if you look at the numbers between 2008 to 2018, we've seen a market shift and increase in anxiety. So primarily with the young adults, so ages 18 to 25 have been most effective. Their numbers went from like 8% up to like 14%. So almost a doubling.
What do we think is driving that? I mean, I'm immediately going to blame it on social media, but what do we think is behind it?
Well, I think social media plays a role, but it's probably multifaceted. I think one thing that we note in clinical practice that seems to be a reoccurring theme is just access to too much information. And it seems like we're presented with the information that's most despairing all the time too. And so we see this overestimation of threat. Our brains weren't really wired to know every problem in the universe, but we're being told every problem in the universe.
Yeah.
And so that in that sense, I think there's like information overload. I think, the social landscape has changed. And again, kids have access to the opinions of lots and lots of other kids. There is this push to tell everyone how you feel about everything. And it also seems like you're being watched and you have to present your best self at all times to all people. And then I think a final thing, I think from my perspective, would be lifestyle expectations. Meaning that there's this problem of comparison constantly. And as, quality of life standards increase, expectations of meeting certain sorts of benchmarks during your life also increase. And then we kind of fall prey to our own expectations or standards.
Oh, I think that's so true and so fascinating that, your world is wider, which is good in so many ways. But now your comparative set is as wide as you want it to be. You're kind of cherry picking the best of the best to benchmark. We've all certainly in our community talked about the Instagram culture of first it was Pinterest for moms, right? And then it was Instagram, but it's just, what does your house look like? What does your food look like? How are your kids dressed? Like, where are you vacationing? All of that pressure gets internalized as I'm not doing this right. There's something that I'm not doing right. And that can be linked to anxiety related disorders. So I think that's an important point for the listener is there's sort of an array of anxiety related disorders. What are some of them? You mentioned OCD before.
Yeah. So OCD actually in the DSM, the previous DSM, the DSM-4 TR, OCD was actually listed under anxiety. It's no longer under anxiety. It's a sort of separate category, but it's related because the primarily emotional response tends to be anxiety, but it's not in there because it also can be disgust or guilt or other types of emotions. So it's its own separate category, but definitely related.
Mm-hmm.
And then the common anxiety disorders would be, separation anxiety, social anxiety, panic disorder with agoraphobia or without agoraphobia, generalized anxiety disorder, specific phobias, really an array, anything that you can imagine.
Right. And I think for people who aren't familiar with the DSM, can you just explain what that is?
Yeah. So the DSM is the American Psychiatric's attempt at providing diagnostic measures for us to use or criteria. And so in psychiatry, as different to a lot of other areas of medicine, we don't diagnose based upon any sort of biomarkers. It's based on symptom clusters. So it's a lot of fancy statistics in which they say these symptoms tend to cluster together. Therefore, it's a disorder. And it has its own name. For those of us kind of like doing the groundwork in the field, what we realize is that in psychiatry, there's oftentimes a lot of comorbidities, meaning that when you have one disorder, your chances of having another disorder increase dramatically. And so, the question has always been, are they really separate? If you have a 50% chance of having depression when you've got generalized anxiety disorder, are they really two separate psychopathologies? And I think the field's working to change that. There's some really promising research looking at genetics and a variety of other factors to come up with, I guess, a more clear way of diagnosing. But that's kind of where we're at as a field.
So this was something that I did not know a lot about, but if you're listening and you have not had someone in your family go through a diagnostic process with like a psychiatrist, you're essentially they are asked a series of questions. And that series of questions and how they're answered under this algorithm of the DSM provides a diagnosis. So you can, in fact, somebody could go see Dr. Fite and walk out with 3 or 4 or 5 like labeled diagnoses based on their answers to those DSM questions. So just if you're listening and that's like, how does that work? How do we know? Is it do we do a brain scan? Do we take a blood test? Like, no, in this field, it really is based on the patient's ability to verbalize what those symptoms are.
And just so you guys know, too, it's important to also understand that another thing to consider is that the field has been really moving towards transdiagnostic approaches to treatment. So when you look at like the most recent psychotherapy protocols, you have manuals in which you're using one type of psychotherapy for a variety of presenting problems. And even in the field of psychiatry, think about you could have any of the anxiety disorders and the medication you would be using would be essentially the same one. It would be an SSRI. And if you had depression, you'd also be using an SSRI, which is a selective serotonin reuptake inhibitor. So even when it comes to the treatment, we're seeing common mechanisms in the treatment of all these different psychopathology.
Which kind of backs up your theory that there's probably a lot going on that's linking some of these things together symptomatically. Yeah. Do you ever find yourself saying, I just need a minute to breathe? While the whole idea of meditation can sound totally intimidating, I've found that stepping away from the chaos of life, even just for a few minutes, is incredibly restorative. So if you're short on time, but could use a few moments of peace right about now, listen to my 5-minute meditation for working moms. It'll help you clear your head and come back to your day feeling centered and refreshed. Head over to brilliant-balance.com/breathe. Press play and settle in for a few mini moments of peace right now. Let's talk a little bit about specifically the relationship between anxiety and our need for control. And I'm asking you that because I've heard you talk about this, right? Letting go of control, grappling with uncertainty. And I also know that we're speaking to an audience today who would probably universally say we like control a whole bunch. Our ability to predict the future and feel 100% certain about outcomes would make us really happy, especially as moms. But can you explain the relationship between anxiety disorders and control and uncertainty?
Yeah. So, we're always trying to look for, like I mentioned before, common mechanisms that seem to be related to the disorders. And one personality trait that tends to come up quite frequently with anxiety disorders, I mean, you could almost guarantee that it's happening, is this need for over control of the environment. Another way to put it would be a fear of uncertainty. And so people who are really driven to be in a position where they know everything that's going to happen in the sequence and the order and what the outcome is going to be. And so when we think about and we conceptualize like generalized anxiety or OCD, oftentimes the way that we frame it in treatment is saying that we're trying to increase your tolerance for uncertainty, meaning that your threshold for tolerating uncertainty has been impaired to a certain degree. And then maybe another way to put it too would be from like an evolutionary perspective. So, imagine you're walking through a forest and, you're an early human and you've sort of evolved to survive. The people who are going to survive best are the ones who are going to be most in tune with the environment. So like any ambient noise that might signal some sort of threat would make you turn around and check, right? So you'd be trying to control your environment and notice everything around you. So that's precisely what happens, but it happens to like modern day questions and life circumstances. So it's this over control issue.
Yeah. And that is so fascinating to me. We were shopping on vacation at spring break this year and saw a t-shirt that said, "Relax, nothing is under control." And it made me laugh out loud because I thought, what a great play on words. And yet, if you really give into that idea, if you really buy into the idea that nothing really is under control, right? You get really quickly focused on this moment and mindfulness. So we've talked a lot in this community about the present moment and how really all we have certainty about is where we are right now. You and I sitting here having this conversation, I'm pretty certain about, right? I mean, Zoom could blow up at any second here, but we're pretty sure right now this is what's happening. So does it link us back like therapeutically to the present moment?
Yeah, absolutely. And so along with mindfulness, I think one important thing to remember about mindfulness is a framework for thinking about your posture towards the world is one of acceptance, right? And so what we try to do is accept the things that we can't control. So being in tune with that, and then being present-minded and focused enough to change the things that we can, right? So it's a pragmatic stance, being here, right now. If we're going to impact the future, it has to be through the present moment. We don't know the future. We can't change it ahead of time. We can only change it by what we're doing right in front of us. And if there's limitations to what we can accomplish, no amount of rumination or worrying about it is going to change those limitations. The changes are what they are. So it's just a pragmatic stance of I'll change the things that I can and I'll leave the things that I can't and learn to live with them because I don't have a choice.
And in a way, that changes everything, right? Like in a way, we've then changed pragmatically the things that could have been controlled, but also our posture or our attitude toward the things we can't. So the change in that case is within, right? Versus, okay, we may environmentally be able to change some things or put protections in place or learn new skills, but ultimately our inner response is the final change. That's the surrender piece.
Yeah, I think I like what Marsha Linehan in Dialectical Behavior Therapy says about it. So this was a really pivotal moment for me, and this was the formulation that she gave, which was pain plus non-acceptance equals suffering. And pain is a fact of life. There are going to be things that don't go the way that you want to. There are going to be sensations that you experience that you don't like. But really what makes it suffering is the resistance that we have to accepting reality as it were. And so if we can change our posture towards it to one of acceptance, then it tends to be pain alone. And pain is more tolerable than suffering. And so that's really the aim.
Man, that is some good stuff, right? Pain is more tolerable than suffering. That might be a call out quote from this episode. That it really is. And we'll try to link up her work through DBT as well. One thing that I want to make sure we get to for the listener is, let's say somebody listening feels like, this is sounding like me. I feel like I'm clearly having some of the symptoms you described earlier, or someone in my family is. What's something anyone at home can do today that could begin to alleviate some of that pressure of anxiety before they seek treatment?
Yeah, so I think there's two things to think about. So there's two different processes at play when it comes to treatment. One is coping strategies. And the focus of coping strategies is, how do I get through a moment without making the situation worse, right? And I think some of those quick fixes tend to be coping strategies. So that things that come to mind are, diaphragmatic breathing, which means essentially exhaling longer than you inhale as you're breathing. So maybe like a 5-3 count. Visualization techniques where you close your mind and you envision a place that's tranquil and calm and conducive to calmness. I'm thinking some sorts of meditations can be really effective for people. Stimulation of sorts, like fidgets, can also be good. So I'll give you a really quick acronym that I think is really useful. I use it in my own life. It's called T.I.P.P, T-I.P.P. It stands for temperature. So we know that people have a dive response when they're under cool water. So sticking your head in a bowl with some cool water and pressing that cool water up against your temple for 30 seconds will activate your parasympathetic nervous system and cause a little bit of a relief. Intense exercise. We know after people exercise for about 20 to 30 minutes with intensity, they'll have after the exercise a period of parasympathetic activation that can cause a little bit of relief and anxiety. Progressive muscle relaxation, which really hinges on the idea that when we become anxious, unbeknownst to us, oftentimes our muscles tense up. So learning how to relax those muscles is really important. And then the paced breathing. So those are just a quick few coping strategies. In terms of long-term results, what we know from the research is that the best way of reducing anxiety long-term is a procedure called exposure, or incremental graduated confrontation of fears. And this obviously only works if your fear is an anxiety, meaning that it's an actual threat. As you do this, what will happen is you'll confront the fear, and then you'll find out that whatever you were worried about coming true doesn't. And you figure out that you can tolerate it. And as your brain confronts the fear incrementally, we tend to see a reduction in anxiety over time as your brain learns that you're able to tolerate it and get through it without any severe negative outcome.
Yes. And that's something that you do in your practice. So I was curious, what are some, beyond what people can do at home, what are some of the more, I'll call them advanced strategies or treatments or therapies that would be done in your practice or others like yours? That's one for sure.
So anytime that we're working with anxiety from a psychotherapy end, we're always doing exposure therapy to some degree, because all the protocols, evidence-based protocols for anxiety, involve it in some way or another. So there's different flavors of it. There is sort of the direct in vivo exposure where we just do exposure, we call it exposure. In more of the new third wave psychotherapies, there's like a mindful approach to exposure where we don't call it exposure per se, but we say, is this getting in the way of you achieving your values? If it is, go ahead and do it. Right? But the mechanism of action tends to be the fact that you're going into a situation that you've been avoidant from, and you're doing it now, and you're learning that you can handle it.
Yeah. It's such it sounds like freedom. Like when I listen to you talk about it, and I hope that people listening are thinking, anxiety can really start to rob someone of their freedom, right? The world can shrink and become smaller and smaller because fewer and fewer things seem safe and doable. And what I hear when you talk about those therapies is it's this expansion process of like reopening the world and the things that are available to be enjoyed and experienced. So I think it's such important work that you're doing to do that. And I know, just like we were saying earlier, it's this kind of increasing problem that needs increasing solutions, more practitioners, more access. How does someone know when it's time to seek professional help?
It's interesting. I think that answer is a little bit different for everyone. I think if I were to give a suggestion, I'm going to think of the people I care about most, like my kids. I think prevention is the best solution to the problem. So if you're feeling like anxiety is getting in the way, even in a subtle way, or you know that you have a tendency, maybe in terms of genetics, hereditary tendency towards anxiety, it might be good to go in and learn the skills ahead of time. In that sense, your protocol would typically be less intense, and it could really prevent you from having to go through a lot of suffering that you would go through otherwise if you didn't get the treatment. So I think prevention is the best way to do it. Oftentimes people think I have to be in a really bad place to go to therapy. I say, no, the type of skills that we teach are really good skills for anyone.
Mm-hmm.
So you don't have to be in the depths of depression or completely paralyzed by anxiety to seek out psychotherapy. You can do it ahead of time. So it's just kind of like good exercise for the brain.
Yeah, it's when it's still in the realm of health. Like you're still in the realm of I'm building skills, just like, we would teach our kids good nutrition. We wouldn't wait to make that an intervention. It's like, no, I want you to know good nutrition from birth and be sort of have conversations about that all the way through life. So you have those habits that you can use, right? No matter what's happening in your life. I think that's not the answer I expected you to give. And it's great reframe of it's really never too soon. It's something that I really wish, and I do see some evidence of this. I wish we were teaching more in schools, because I feel like if kids were given some of these tools as basic education, it just teaches emotional maturity and frameworks that they can leverage and share with others. So I love that. Love it.
I'm going to segue off of that a little bit. I know Ohio is right now testing out social emotional learning standards that they're going to be teaching in schools. Illinois already has them. There's a lot of research going in that capacity. And we're seeing, at least in the research data, longitudinal data, that it does make a difference for kids.
It would have to, right? It would just have to, these skills, because we were not all taught them. This generation of parents certainly did not all grow up knowing them. So the sooner we get them into the hands of kids through experts, the sooner we have a generation who does have those skills. Where, I will link this in the show notes, but verbally, where can people find your work online?
Yeah, it's the CincinnatiAnxietyCenter.com.
Perfect. So they can Google that or go straight to it. Are you able to treat patients outside of Ohio?
Right now, we are not. We're just treating patients in Ohio. And normally, even if it were the case that we could, we would normally recommend seeing a psychotherapist who is local, overseeing one over teletherapy. And I think the reason why is, particularly when you're treating anxiety disorders, some of the work that we do involves in vivo exposures. Or what I mean by that is going out in the community and doing exposures, confronting your fears. And it's just done best when you're live with that person. So that would be my recommendation.
Yeah. And it's one of my wish fors in my lifetime that we'll see it become easier to find, get connected with, get appointments with these providers and practitioners. So if you are in Ohio, if you're local to Cincinnati, which is of course where Brilliant Balance is headquartered and where I broadcast from, certainly check out Dr. Fite's practice. If you are a listener anywhere else in the country or the world, I'm sure there are search terms that you could Google that would get you to anxiety clinics in your area.
Let me kind of give you another suggestion. So if you go to the Anxiety and Depression Association of America, you can look up for therapists in your area using your zip code. And so these are ones who are associated with the ADAA, which gives me more confidence that they're using the types of treatments that'll be effective. So that's a really good organization to look for, ADAA, and their therapist search.
Awesome. Awesome. Well, thank you so much for being with us today, for educating all of our listeners. I know this is such an important topic that is so close to our hearts. Mental health in general is a topic that is really coming up increasingly in our community. And so I thank you for sharing your expertise with us.
Of course, it's a pleasure. Thank you for having me.
Well, my friends, thank you for joining me today for this episode with Dr. Fite. I pray that you learned something that you can apply right away today in your own life to feel better, to really release some of our false beliefs around the fact that we have control over anything, and to live a little more comfortably with uncertainty and see what kind of freedom that can provide for you and for your family and for the people that you work with. If you are new to this community and just finding the Brilliant Balance podcast, come join us in the Facebook group. It's called Brilliant Balance. Just go to Facebook, search groups for Brilliant Balance and request to join. You can find us in our online home at brilliant-balance.com. And that website is kind of the jumping off point to all of our various coaching pathways and other services that you can take advantage of, including a whole bunch of free resources. So I am so glad that you found this episode today. Thanks for listening. And until next time, let's be brilliant.
This is thepodcastfactory.com.